Hello, this is the NICU Lived Network, and we are your hosts. I'm Melinda.
I'm Nat.
And I'm Emma. We are all NICU mothers using our lived experience to partner with health professionals to impact research, advocacy, and clinical practice.
Each week we will bring you something new. It could be a topic highlight, the latest in research, a visit to a NICU, or ways in which you can use your lived experience within the NICU to impact change. We hope you enjoy this episode.
Hi everyone, it's Nat, Mel and Em here again for another week of talking about neonatal/perinatal matters. This is our second video, and today we're going to be talking a little bit about consumer reps. Specifically, what is a consumer rep? What kind of work does a consumer rep do? And what does being a consumer rep mean to us? So I guess for me, the first thing I wanted to start off with the term consumer rep. It's probably a little bit political, but essentially, a consumer rep is somebody who uses uses their experience or the experience of others to provide the perspective of a consumer, and uses it in improving health services, etc. But I guess there's always been an issue with the word consumer. And my personal preference has always been to use the word someone with lived experience. I don't know about you guys, if you guys had any opinions about that.
I wouldn't say I'm the biggest fan of consumer, because I don't think as a consumer you see somebody that's chosen to go through a journey. It's used commonly throughout the medical practice. I get it, but yeah, consumer representative is it, like you say, Nat, it is somebody that has been through, got lived experience. I'm sure there's a way better name for it than what it's called in the medical profession. But yes, to summarize, it's someone that's lived that experience that can contribute back and talk about it as somebody that's actually been through.
Yeah. It's true, because if you Google the word, it's actually someone who's purchased goods or services for personal use. Yeah. So I guess I kind of understand where they're thinking about it in regards to health, but it's not, going through the NICU experience, it's definitely not something you would choose. It's not like we made a conscious choice to say, yeah, we want to be part of this group and this club. But I guess the thing, and one of the reasons we need to make it a little bit relevant is because it's globally used, like that universal discussion. But it is changing. It definitely is. There's lots of other different words that are being used. Talking about your lived experience is something that is becoming more and more, hence the name of our NICU Lived network. And also in the UK, they're starting to use a term called PPI, which is either patient and public involvement or patient and parent involvement when it works into our space. So there are different terms to come across, but yeah, consumer, unfortunately, is the one that sticks. And it's not just us. Before we hit record, I was talking to you both about when I speak to doctors. So this week spoke to Dr. Brett Manley from the Royal Women's in Melbourne, and he actually said to me on the phone, what do you think of the word consumer? So they question it too, but yeah, unfortunately for some part of it, we're a little bit stuck with it.
Yeah, and I think fundamentally we're here to have a voice as a parent, as a somebody that might be a premi, but somebody that's had that lived experience, that voice, and that connection piece to the medical professions, research, hospitals. So that's fundamentally what a consumer representative is, parental, representation, really.
Yeah. I might show one of the slides that we have that we've used at presentations in the past, which might be a little bit of a visual, so that there is two types of the ways parents are obviously involved when it comes to health within the NICU. So the first thing, obviously, you've actually gone through the experience. So you are the ones that use the service. You've delivered a baby that's born premature or sick, and you've actually spent time in the NICU. So babies are patients, and we're the parents of those patients. But then once you've gone through that journey, you then become, similar to us, where you decide to engage to improve the service. So that's where you become either a consumer rep, those with lived experiences, or the PPI that I was mentioning. And the way it circles back is that we're using our journey to come back and then make a difference to the ones that then find themselves back in and using the service. So that's I thought that was a really good slide that would help visualize that.
And I guess it's really interesting when you, when I started becoming involved, well, I should firstly credit you, Melinda, because I didn't realize something like a consumer rep in the neonatal space really existed until I saw you and what you were doing in terms of being involved in studies and reviewing things for the health services, etc. And that really kind of, I'm like, oh, for me, it was a way, for me to think about, wow, I can use everything that we went through and be able to use it in a specific way to help other families.
Mm-hmm.
But it was interesting because when we first started, I had really no idea of kind of the spectrum of the work that the consumer could do. So it's been really interesting the last couple of years becoming involved in that. And, initially I thought it was just about reviewing, fact sheets for patients and or guidelines or something like that, that kind of very quite a simple exercise of saying, here's documentations, can you edit it or put your comments in from a parent's perspective. But it's interesting as the years go by, becoming increasingly involved in more things, not so much reviewing, but, getting involved in like research related things and committees where it's all about actual decision making and planning and design. That's really, really interesting, fascinating and exciting for me.
Yeah, like you don't realize that you can actually have have contribution at such a high level of actually sitting at the table and being side by side behind the decision makers and being one yourself. Like I think that's incredible. Yeah.
Absolutely. I think it was back in 2017, a bit like this, where I saw something on social media where they were looking for consumer representatives to join. And again, like Nat, I didn't have a huge idea around, but I was, my son was 3 at the time. I'd gone through that journey. I thought it was a really nice way to contribute back. But since then, I've sit on the Australia and New Zealand neonatal network, and I've worked in workshops and breakout groups all around family centre care, which has been amazing to see, I guess, the involvement. So we're able to talk through our experience and understand what the hospitals are doing and what they want to achieve. So for me, just again, having that voice at the table to be able to help shape, family integrated care or be part of research projects as well is just, it's huge.
So we've got a little video that I think it's the healthcare, or I might get this wrong, hopefully I don't. The Healthcare Consumers Association of the ACT have put together just to talk about consumer representation. So we might play that and that will help people understand a little bit more about the role.
Consumer representation is an important activity to ensure that health services are meeting the needs of the community. So it's important that those voices are heard.
To me, it's about lived experience. So it's representing your lived experience or the lived experience of people that you know, and bringing that to the table.
Consumer representation is ensuring that the voice of the consumer is heard by service providers and service designers, so we get services that are fit for purpose.
Consumer representation is consumers being actively involved in all aspects of healthcare, in the planning and the monitoring and looking at the outcomes of what happens to consumers when they use healthcare services.
So I think that's a really, good way to have a look at what representation does. And it's not just in the NICU space. Like this happens across all areas of healthcare. But we're, committed to driving it forward for NICU families and the work that happens within the NICUs. The other thing I wanted to mention too is that it's actually government policy. So I've got in 2004, in their model framework, the Australian National Health and Medical Research Council actually documented that they encourage the appointment of consumers as decision makers in research. So that was something really important. And that's in 2004. And the very first time, so when I was first approached to be part of and be a consumer rep in research, it didn't happen until 2012. So it's 8 years before, parents were being included, but what we've been able to do in the last 10 years has been absolutely amazing. And as you were both mentioning, these are some of the ways that parents can be involved and use their lived experience to make a difference. You mentioned being part of the ANZNN as on their executive committee, and Nat, you're part of the PSANS Consumer Advisory Panel, and then also being part as a trial investigator, sitting on trials, being part of different review boards, and then co-authoring publications. So there's lots of different ways it's really changed from being, here's an information sheet, can you check it out for us, and actually being really involved.
Yeah. And I think we were talking about it just before. I think because it can be quite nerve-wracking, kind of nerve-wracking sitting in those meetings and, and not understand what they're talking, because it can be, quite clinical a lot of times, the discussions and that. But I think kind of in a way, and just kind of going, well, this is who I am the consumer, and just kind of, in a way, kind of just be okay with saying, hey, I don't understand. Break this down for me.
Yes.
Like being comfortable with being uncomfortable all the time. And just,
Absolutely. Yeah. So just before we jumped on this, I was on a different meeting for a research project, the only parent on the call, and trying to understand the proposal and what the research is about, and getting asked questions. And I did at one stage, I was like, no professional training here. Bear with me, I'm trying to learn. But also being comfortable enough to do that, but the privilege and the honor to be able to sit at, in those meetings and actually be heard, and I think that's what really matters for families.
And I think equally it's an opportunity. So obviously you can work full time and still jump in and jump out as you need to. So I think for me, that's been really good. So I can work full time. I can work on this on the side. It doesn't take a huge amount outside of it to be involved, but also to know that time that you are taking and working. And I've asked many questions going, I have no idea. Can you please explain again? The medical professionals don't expect you to know everything at all, which is good, thankfully. But yeah, I think you can jump in, help, and you are actually the research then, or the projects that you're working on then evolves into something much bigger, which is good. So for for a time investment, a small time investment, it makes some massive impacts, I guess, for people going through that journey and that CPI side of things, so the clinical practice improvements.
I think that brings to the point of what does it mean for us to be involved, and I think you've hit it on the nail there. Is that for me it's about using that lived experience and being able to make a real hopefully make a difference or make life a little bit better for other families going through that journey.
Yeah, absolutely. I remember leaving the hospital with Dylan, so he was my 27-weeker, and spending 9 weeks there, and just feeling, that it was very overwhelming. But one of the things that I felt was an overwhelming feeling of gratitude for the work that they did and the fact that I was getting to take him home. And I think I intrinsically knew in that moment that if the opportunity came to be able to give back and help make a difference, I knew I wanted to be part of it. So I think, being able to do that and then hopefully helping to pave the way, particularly through this network, on how parents can use that experience and do that. I think that's, that's a big driver for me, like what it means to me. And then to be able to see that more parents do want to be a part of this side of health, and contribute and make a difference. And it's not just parents. Globally, there's also a movement of prems that were born, babies or, young adults now that were born early that now want to come into the space, and the door's open. Like, it's absolutely open, which is fantastic.
That's good. I was explaining to my 8-year-old son, he was 27 weeks, around what I was doing, and he said, "That's really cool, mummy." So he was like, I want to do that when I get older. So I think that he can see the value that it gives back to future, current, premies and families going through it. So it's cool, apparently, according to an 8-year-old child.
Yeah, absolutely.
That's magical. That is. Well, I'm mindful that we've now hit 15 minutes, so we should probably wrap up. So I hope everyone's enjoyed our conversation today. And did you guys want to mention anything quickly before?
No, just that we hope that we will continue to open the door for more parents to realise what can be done as we move through the weeks, and that they'll join us, which is fantastic.
And I think if there's any questions or any comments, like feel free to pop something up on the post, or send us a message, get involved. We're here to answer any questions outside of this too.
Yes. Thank you, everyone, and we'll chat next week. See you.
That's a wrap on another episode of the NICU Live Network. Thanks for joining us today. To stay connected, please make sure you're following us on social media and have joined our Facebook group.
And if you found value in this episode, please share, like, or comment.
We'll see you on the next episode.